Hello, and welcome to the AMA's Steps Forward podcast series. We'll hear from healthcare leaders nationwide about real-world solutions to the challenges that practices are confronting today. Solutions that help put the joy back into medicine. AMA's Steps Forward program is open access and free to all at stepsforward.org.
Hello, everyone. Welcome. Thanks for joining us today for this episode in the AMA Steps Forward podcast series. My name is Dr. Kevin Hopkins. I'm a family physician and operational leader at Cleveland Clinic in Cleveland, Ohio. I also work for the AMA as a senior physician advisor for practice transformation. Today, we're fortunate to have my friend and colleague, Dr. Ann Pendo. Dr. Pendo is an internal medicine physician. She's also the senior medical director for physician and APP well-being and experience, and has oversight of ambulatory internal medicine operations at Intermountain Health in Utah. Ann, thank you for joining us. I had the great opportunity in late October of 2022 to visit you at Intermountain for the Advances in Primary Care Medicine conference, where I had the opportunity to speak to the audience about the effects of physician burnout. And then recently, we were able to reconnect again at the American Conference on Physician Health in Palm Springs, California. So it's great to have you with us as a guest this morning. Thank you.
You are very welcome. I'm pleased to be here today.
So I gave a little bit of your background. If you could please share with our audience today a little more about yourself and how you got to this point in your career, what your interests and passions are, and what gets you out of bed and coming to work every day.
I love that question. Thank you for asking. Well, I've been an internist for over 30 years, which is really hard to believe. And one of the things that I particularly love about my practice, because I still see patients, is the opportunity to build relationships by being curious and really listening well and solving problems together. And I think that foundation has really translated into my leadership roles. And if it's okay with you, I've got a couple stories that really demonstrate those. There's two moments that really stand out to me. And the first is from a number of years ago, before I had a formal leadership role, when for quality measurement and pay for performance, we were asked to do a manual chart review and documentation of our patients that were attributed to us. And I had a busy practice. I had 3 small children. All of that was incredibly time consuming. And then I had this additional request that was also time consuming. And the ask was to hand deliver boxes of these documents to the post office on a particular day by this 5 p.m. deadline.
That sounds terrible right out the chute, but go ahead.
Yes, it gets worse because it was a dark and snowy night. It was at dinner time, right at the time the post office was closing. I need to get home to relieve our nanny and feed my family dinner. Got to the post office just at closing time, and the door was locked. And I knocked on the door, and this very kind woman opened the door for me. I was on the verge of tears. And as I was driving home to a family I love dearly, I realized that I did not want to be a data entry physician, that is not where my joy and passion was, because it was taking me away from the things that I love most and hold dear, which are my patients that I care for in partnership and my family. And as I was thinking about what can I do, how can I be part of the solution and change, that was the impetus to apply for my first medical director role, which I did in probably 2014, 2015, and had the opportunity to be part of the change. And happily, it really was able to use that relationship building and team problem solving to advance the work with the teams that I was responsible for. My second moment was in that role as I was a medical director. And one of the physicians that reported to me was not submitting their billing. And as you know, that's a problem. And as we were preparing, my partner and I, for our crucial conversation, The typical approach would have been, you need to do this. We're going to check on you. And if you don't do it, there will be some consequence. And it's usually not a positive consequence. And I realized during that prep that behavior was not typical for that physician, that was unusual. I used my skills of deep listening and being curious. And I wondered what was behind that behavior. There was probably something behind it. I asked, I listened, and I learned that this physician was incredibly distressed, was actually thinking of leaving medicine because he believed he couldn't meet the expectations he was putting on himself. He wasn't the parent, the spouse, or the physician that he wanted to be. And his belief was the only solution was to leave his profession, which he loved dearly. In some subsequent coaching conversations, had the opportunity to talk about with him, like what mattered most for him. What were the actions he could take to get that? And it was going to require some change in how he thought, change in what he said yes and no to. I'm pleased to say that he is thriving, both personally and professionally, and is one of our senior leaders, which is wonderful. We all have life, and life happens to us. And we are so programmed to be perfect and fixing everything and saying yes to everything. And I realized that there was no safe space to say, I need some help. I need help figuring this out. I need help navigating that. And as I thought about our conversation, I realized that we had a relationship. We trusted each other. We were able to be vulnerable and authentic with each other. And I had the courage to ask the hard questions, and he had the courage to answer. I then realized that if we're not well ourselves, we can't do the work we love and be the person that we want to be taking care of anybody else, whether it's our partner, our families, our patients, and those we love. And that was really the moment of thinking about how do we change culture, recognizing that that is a long road. But how do we change culture to really start thinking about what can we do to embed well-being as leaders into our day-to-day leadership job?
Wow. Stories are really powerful, right? And so I guarantee you that there's somebody listening to this podcast who has a lot of those same thoughts and feelings of, I need to do something different. I need to make a change. And it's got to be dramatic and drastic because what I'm doing right now is not sustainable. And there's probably a lot of people in our profession right now who are feeling that way. So thank you for sharing those stories. There's so much of what you unpacked there that I really love. I think about the asking the questions. As physicians, we're fixers, right? And so we want to say, oh, I see the problem and here's how you fix it. And we can tend towards sort of that paternalistic aspect of, this is what you should do and how you should do it. And you have to do this and it's got to be done by this time. But we're also diagnosticians. And how we get to that point is by asking a lot of questions, the same types of questions that you ask, recognizing that behavior oftentimes is a symptom of what's going on in the person's life, in their mind, especially when it's out of character or out of sort of what's been normal historical behavior for them. So much of what you just talked about, I really love. So that really moved you into desiring to be in leadership position, wanting to make a difference, wanting to improve the system, not just for yourself, but for others and for patients and all of that. And so how did you then end up helping to lead the well-being efforts at Intermountain?
Well, I had shared directly with my leader that that's what I wanted to do. Initially, when we had the conversation, there wasn't a role, there wasn't interest really in that. And then over time, there became an interest, and the organization had engaged with an external specialist in well-being from outside our organization. And it was clear to that person that the organization wasn't quite ready. As a result, they exited And the leader that I had originally expressed interest to called me on the phone and said, "Will you do this?"
The system wasn't ready, or the executive leadership of the organization wasn't ready, or both? What do you think?
It was both. I think it was both. I think that there was so much pressure on our executive leaders with their day-to-day work, and they had a challenge to think about, I can't add one more thing. And this was perceived as one more thing. I think that's a great question that you asked, because it is a great example of what I've learned over these last 5 years is, how do you navigate something that you are very passionate about when there is a variety of, or a variable interest in this work? That was a hard lesson. It was well earned.
So many of us have so little margin left, and so when one more thing does pop up, even if it's a good thing, you're right, we just can't bear to think about it. One of my great colleagues at the AMA here, Dr. Jill Ginn, she uses a cartoon at the end of her speaking slides often that has two guys pushing a cart, and it's got square wheels on it. And another guy comes up to them holding a round wheel, and the two guys pushing the cart with the square wheel say, "No, no, sorry, we're too busy," And let's put the round wheel on here. Let's make, what's the one thing that we could do that by doing it could make everything else that we need to do a little easier. So even if it's that type of thing, we just oftentimes just don't have the room for it.
Yeah, I think that's a great example. What it did do for me is it allowed me some time and space to think about how I wanted to organize this work. I used the Stanford Wellbeing Model and attended their Chief Wellness Officer leadership course, which really allowed me to organize the work in a way that was evidence-based and met the needs of our organization. And it allowed me to practice, try things, see who was interested, see who was not wanting to have conversations about this. And so I learned a lot in that beginning time.
Yeah, so being the first in your organization in this type of position, not having really a precedent or a predecessor to look to, what were the first things you did? What did you do? What did you set out to accomplish maybe in that first 90 days?
So I think in that first 90 days, it really was what I just described, and then recognized that creating a culture of well-being was our first task, my first task. And what I put in that bucket was leadership. How do leaders lead with this well-being mindset, and how do we really make it be part of leadership? The second piece was that efficiency of practice. That's a system issue. And so I knew that my role there was really elevating, leading in that sphere of influence, awareness, issues, et cetera. And then the last piece was the personal resilience and well-being, recognizing that a small slice of that belongs to the individual. But the majority of that is really, how does the organization or the health system support our physicians and APPs in preventive ways, and then also when things don't go right, when there's a safety event or a malpractice suit or something that's incredibly challenging. And so, having no precedent, I figured I could try something. And that was what we talked about, was what was at that time learning and leadership.
Well, and leadership and culture within an organization are very powerful drivers, and they're inextricably linked. I mentioned Dr. Jin. She and I did a podcast not long ago in this series on our wellness-centered leadership playbook as part of the Steps Forward resources that are available. We had a great conversation about how important organizational leaders are in setting the tone. And by nature, all physicians, whether they want to admit it or not, are leaders. They're looked to by those around them inside and outside their healthcare system, and how they react in certain circumstances and how they behave and proactively act sort of sets the tone for the organization and for the group. So over the last, I don't know, 4 or 5 years, maybe, correct me if I'm wrong, Intermountain Health has has invested in caregiver well-being and has championed several caregiver well-being initiatives with you helping to lead that effort. I know one of those specifically is around training leaders to help improve well-being and the culture of well-being at Intermountain. That's the Learning and Leadership program. Could you tell us about maybe what the impetus for its development was, and then describe what the program is and how it works?
Yeah, I'm happy to do that. So this program was started in March of 2019. It was started really as I go back to, what is essential to me, how do we build relationships? How do we solve problems together? And so created this learning and leadership to do that, recognizing that leadership is lonely. And how could we create this community? How could we create these connections, build these relationships where we recognize that we're in this together and it's okay to learn together. We can practice, we can share the hard things. And as I thought about my leadership to that point, I thought about who are the people that I had relationships with in my leadership role that I didn't have relationships when I was just in my clinical role, and who were some of my trusted partners. And I asked them to join our call, and we had a conversation, me describing what my experience with them was like, and vice versa. And the audience had an opportunity to ask questions and have them be answered. And the very first guest was my HR business partner, because we had been together managing through crucial conversations, me learning from her and she learning from me. And it went well. It was people joined, which I was worried that no one would show up. Then a year later, COVID happened. And that was really a moment that changed everything. As I think about our leaders, this was not a space where we had answers. So there was a lot of uncertainty and fear and isolation and anxiety and this deep, deep sense of responsibility. And how do I navigate through this incredibly difficult experience without a lot of information? What I was hearing from a lot of our leaders is, I'm really worried about my team. I don't know how to take care of them. I don't know what to do for them. I don't know what to do for their families. I don't know what to do for the people I love dearly. How do I work and go home and keep them safe? And so we were courageous and we talked about feelings, which was uncomfortable to start, of course, at first. And then as I was able to model some of that authenticity, vulnerability, curiosity, asking questions, how are you navigating this? What are you learning? Kind of normalizing our experience, people continued to join, and we started developing actions and resources to support them and their teams, really with that listening, a growth mindset, and creating that safe space.
It's so interesting to me that you had started this not quite even a year before COVID, and so it was something that you had infrastructure that you had in place, and then you sort of pivoted and leveraged it to be used for communication, training, development, sharing best practices, encouraging one another across leaders in the organization to really take care of your teams throughout the pandemic. That's really cool.
And remember, I said earlier, meeting the people that were ready. This group was ready, and they were, like I said, that deep sense of responsibility. They were ready and willing and wanted to be part of this group. And it was obviously important and useful. As I said, people kept returning. And then in January of 2021, within a month of each other, we had 2 physicians die by suicide. And that really rocked our world. So we have COVID, and then we have these 2 unexpected deaths. And that was really another shift for us in our community, in our learning and leadership community, which is now called the Leader Roundtable. We brought the group together We honored a month apart the physicians that had died. We talked about our relationships with them, what they had meant to us. And we also talked about, now you're going to go talk to your teams. What are the things that you need as a leader to be able to do that and feel confident to do that? So we really shifted to, okay, what do we need to now do a little bit differently? So people in this space of mental well-being, what do we need to do? How do we normalize help seeking? How do we make it not afraid to talk about the things that we don't like to talk about? And actually from that, created and implemented a peer support program in the fall of 2021 as a result of this, really thinking about, again, what can we do? What's possible? In September, it's Suicide Awareness Month. So we focus on talking about that and having a conversation with two of our physicians, one of whom was concerned about her colleague who had said he had some thoughts of self-harm. What did they do in the conversation? What was that like for each of them? To give our audience confidence to not be afraid when they're worried about someone to ask. We have our engagement survey. How do we look at those results and learn together to think about what's getting in the way of well-being of our teams and what meaningful actions can we take? Just before Thanksgiving, we had a session about how do you take care of you? And what are you going to do to take care of you, and how it's different for everybody. And think about that and write it down and put it in the chat. And at the end, what relationships do you want to invest in? What emotion do you want more of in 2024? And then I asked the audience to write a little message to themselves as we start this holiday season where our demands increase both at work and at home. So that's kind of our structure, and it's been going now since 2019, and it's expanded, and I'm anticipating that it will continue because it's still meeting a need.
You mentioned earlier physicians, and certainly physician leaders included in this, hesitancy to ask for help, depending on when you trained, sort of your generational factors and considerations. We were taught at one time, whether overtly or covertly, that asking for help was a sign of weakness. We shouldn't do that. We just sort of put our head down and keep churning through. And it turns out that technique doesn't work very well every time. And so, have you seen in your organization and outside your organization more of a willingness to ask for help as some of the barriers to that are removed, and or more of a willingness to be vulnerable with your leaders, being willing to talk about maybe when a situation didn't go well? Have you seen any shift in openness and willingness to engage in that?
Yes, I would say that the leaders that attend are really a broad group. So we have some leaders that support point of care teams, and then we have leaders that lead teams. So it's a mix of leader levels. When the higher level leaders share, it's incredibly powerful because they've had experiences, they've had life experiences and work experiences. Being able to talk about what's been hard for me personally has really been able to kind of make that acceptable. And I think it's uncomfortable because it's kind of been trained out of us. The other thing I've seen, which has been incredibly positive, is when leaders are getting ready to have a difficult conversation, they often contact us through peer support. We have a peer support email address, and they'll ask, okay, I'm getting ready to have this conversation. Help me think through this. What resources do I need to have at my fingertips? And we're seeing more and more of that, and more people recognizing when someone's struggling and saying, I'm going to connect you to peer support, or I want you to talk to this person. So we're seeing that. I mean, it's been slow, very clearly it's been slow, but I would say today it's kind of become the norm. So when you have a malpractice suit, somebody checks in with you. We assign you a peer supporter. So it's actions that demonstrate that we believe in the words that we say.
Mhm. That's really great to have that available as a resource, because I think a lot of people would consider going to HR before those conversations, and their HR professionals are going to approach that in a much different way than somebody who's trained in peer support, especially physician to physician, might lead you to approach it, and it should be seen as proactive, not punitive. So many places the peer support program is for a response for a bad outcome, or like you said, a lawsuit or something like that. But we need to be supported by each other when things are bad and when things are good. So I love that resource is available. Devastating, the story about two physicians being lost to suicide in your organization. We know, based on data reports, that nearly every day, or more than once a day in the United States, on average, a physician takes their own life, and certainly tragic. And so anything we can do to encourage ourselves and encourage others to seek help when it's needed is going to be a favorable thing. We talked about some things that are done at Intermountain through your office and programs for leaders. Are there other structured programs or offerings for well-being that are offered to frontline caregivers, even full-time physicians, but like clinical, clerical staff, nursing? Are there tools and resources for them that are provided in your organization?
Yes. So I was very intentional when I stepped into this role. I recognized that the way we were going to have success was to work really closely with our partners who have responsibility for that. So we didn't want to create something that was just separate for physicians without having it be available to the entire organization. The Learning and Leadership Call, or the Leader Roundtable Call, is specifically for physicians and APPs. I will have guests that aren't physician leaders, but that space is somewhat sacred. But the peer support, the talking about how we check in with people, how do we know where to go for resources? We developed a well-being resource site for all of our caregivers based on the work that we've done together with our other partners, and have a separate one for physicians and APPs because we support both employed and affiliated physicians and APPs. So, but it's aligned. It doesn't look different. It's very coordinated, and we thought that was incredibly important.
Yeah, it definitely seems like it. And as the effects of COVID have demonstrated, the sort of epidemic of physician burnout really pre-existed the pandemic, but burnout, exhaustion, fatigue, like that's extended not just physicians, it's affecting all healthcare workers of every stripe. And so it's certainly important that we connect people who need it most with care and services that they can benefit from. What have you seen? And I don't know how you quantify this. I know there are models that help with estimations, but what have you seen as some tangible benefits, outcomes, impacts of the caregiver well-being initiatives and programs that Intermountain, through your leadership, has developed and implemented?
Thanks for asking that question, because partway through my journey, I realized that we need data. We're physicians, we're evidence based, we have a science background, and our finance and operations people look at numbers, look at data as well. And so, really, what I wanted to do was be able to demonstrate this isn't just a nice to have, this is incredibly important. And so, we looked at our physician and APP leaders who attended our leader roundtable regularly and noted that compared to those that didn't, their engagement and experience was higher, their team well-being was higher, their leader index or metric was higher. Their teams had more joy, meaning, and purpose in their work. And so being able to say, we've done this, we started this because we believed it was right, and then be able to say, and as a result, this is data that supports it, has been really important.
You're right. We're in a business that is like most others, where if you can't measure it, you can't manage it, and we have metrics and key performance indicators and OKRs and all of those things. These aren't things that are just nice to have. These are this is core to our business and key to our success, and any type of sustainable model in healthcare is to invest in the well-being of our teams, of our individuals on our teams, and to really work towards continuing to change the culture of healthcare organizations to one that really values well-being, one that really values relationships, because that's what the care that we deliver is based on, and relationships among caregivers are of equal and vital importance. As we come close to the end of our time together, I wanted to ask you, if I'm working for a healthcare system or even a small private independent practice, and I see the need the need for this type of work, investing in caregiver well-being and supporting ourselves and each other, how would I start? Who should I speak with? Who should I engage? I heard you say that you went to the people that you worked with most closely. I think you said my most valued partners, your clinical partners. Is that where I should start? But how and where would I start? Especially thinking about, sorry to ask question on top of question on top of question, but especially thinking about if you have no opportunity to have dedicated resources or budget. What are some ways and places that I might think about starting that isn't going to cost my organization anything and have me go to some committee begging for budget dollars?
Yeah. So I don't have a budget. So I was faced with that. My salary is covered. I have an administrative assistant, but I don't have a budget. So navigating that was challenging, and it really forced me to come up with some clear things for me to think about, which I think will be useful for your audience as well. I personally, as a leader, needed to figure out and determine for me what was my why, what mattered most to me, and who was I serving. And when I became clear on that, I am serving my colleagues, those teams. That created a lot of clarity around why, how, when things get hard, I'm going to keep going. I also would suggest thinking about the things that are only in your control. So I wanted things and I got frustrated. I needed to remind myself those were out of my control. So what could I do? And the leader roundtable was something I could do. Peer support was something I could do. Reminding myself of what I need to take care of me, which is challenging, right? And then finding your people. Like, who are the people that think that this is important and that this matters? Who are your champions? If there is a leader who is willing to step into that, be courageous and step into that vulnerable, authentic space, not be afraid to have all the answers, being able to model that for a group, that I think it's not exactly answering your question, but those to me are the foundational pieces. And then as I looked at our organization, I'm like, who are the people that ask me questions? Who are the people who want to know more? And I'm not afraid to, someone asks me a question, I'll send an email back, let's get together, have a conversation. Again, those relationships, solving problems together, which I think has allowed for this work to continue. And that's something that anyone can do.
When people stop asking questions, they're no longer engaged. As long as they're asking questions, they're engaged and want to see it be better.
And people have asked, I can't believe, what lets you get up in the morning and keep going? And it's that deep belief that we've got work to do around well-being and make it really a core element of leadership.
Yeah. There's plenty of work to do, and there's not enough people to do it. And so thank you for being one of those people who has stepped into the gap and into the fray and is helping to lead in this area around caregiver well-being. Dr. Ann Pendo has been our guest and is the Senior Medical Director for Physician and APP Well-being and Experience at Intermountain Health in Utah. And it's been a pleasure talking with you. Thank you so much for enlightening us and also giving us hope that there is change that's possible and showing us some examples of what you and your team at Intermountain have been able to do. Thank you.
Thank you so much.
Thank you for listening to this episode from the AMA's Steps Forward podcast series. AMA's Steps Forward program is open access and free to all at stepsforward.org. Steps Forward can help put the joy back into medicine by offering real-world solutions to the challenges that your practice is confronting today. We look forward to you joining us next time on the AMA's Steps Forward podcast series, stepsforward.org.